Greetings, friends and followers. This is Nurses Talking, and I am Del Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees. And so today I'm very, very pleased to welcome Anne Adams. Anne is a registered nurse and she's an entrepreneur. She says that's her hobby, but she's an entrepreneur. So welcome, Anne.
Welcome. Thank you for inviting me.
Right. Thank you for doing this. I really do appreciate it. And firstly, I usually want to know why, because for me, the why is big. So why are you a nurse?
Yeah, and I knew you would ask that. But my why is a little roundabout. I was a single mom for quite some time. So really, I went into nursing because I knew it was a consistent career where I could make a decent amount of money to support my family. And it actually wasn't until much later. And I had a background in nutrition and exercise physiology. And even though I worked as a nurse, I would often talk about myself in a different role. When I finally became a nurse coach and learned at a deeper level, I had forgotten some of the stuff I learned in nursing school. I think I was in stress mode during nursing school, but when I became a nurse coach, I really began to embody, wow, nursing is amazing. And my pride has been much more recent as to advocate for nurses and what we do and this expanse of what we do. But it took me a while to get there, for sure.
Yes,
Yeah.
yeah, I can understand that because once you spend your first few years treading water and trying to keep your head above, just trying
Yes.
not to drown. And the thing is, once you find your feet though, and you gain your confidence, you realize, wow, this is a huge thing I get to do.
Yeah, absolutely. And I have a little bit of sadness that it took me so long to embrace that, but it was all for a reason, and so much came to it because so much came with it.
Of course, it's all for a reason. You probably came to it just at the time when you should have. Um, what are the biggest challenges for you though?
I think for me right now, it's spreading the word about what nurses really do and who we
Mm-hmm.
really are. Uh,
Mm-hmm.
I have a great job, um, but letting people know how this is the perfect thing for a nurse to be doing or leading, that's where I find some struggle right now.
Yeah, yeah. What's the current specialty at?
So right now I work at the VA, and I work in
Okay.
an area called polytrauma. And polytrauma works with veterans that have had traumatic brain injuries, and then everything that goes along with that. And
Mm.
oftentimes, what we'll see is chronic pain, PTSD, anxiety, depression. So, working in a holistic way to address all those issues.
Yeah, that's a very difficult area. That must take a lot. That takes a lot out of you, the caregiver too.
Um, No,
It doesn't.
because I think if we really go back to being present for the person,
Hmm.
there can be days, but a lot of times it's just really it feels good. Yeah. And
Okay.
maybe
Okay.
that's because of the coming around to it, and really that now knowing at a deep level and holding
Mhm.
that really holding what a nurse does.
Yes. Hmm.
Yeah, and being grounded in that.
Yeah. 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 We're talking a lot about people seem to be, there are many nurses at this point, particular point in time, who are feeling dissatisfied and not grounded and not sure where to go. They were all even, seem to be flying off in different directions. So is there anything that you think you would like to see change about nursing that would somehow alleviate all of this?
Yeah. And in a lot of healthcare, but especially for nurses, right? We are so good. An important nurse role is helping facilitate others. And we're so good at that. And that I think I would like to see nurses have that compassion while maintaining the healthy boundaries. Right. And yes, and that idea that because nurses are strong, but to have that idea that to be a good, strong nurse, you don't take lunch. You have the nurse bladder, those badges of honor, although
Yes.
they're great, and in certain times that is needed. But let's not make that the norm.
That should not be your everyday.
That should not be your everyday. So let's being able to advocate for each other as a group, what a healthy work environment would be. And that would include breaks, and that
Yeah.
would include time for self-care, and that would include time for growth and continued education.
Yeah. And as you mentioned that, because when we do it, what we're actually doing is teaching other people to treat us that way. We're teaching other people that, it's okay if we don't get a break. It's okay if we don't go to the bathroom. They can demand that we don't get a break. We're teaching them that. We can't afford to teach them that. That's just so unhealthy. And so as we're talking about that, and we talk about self-care, what does that mean to you, though? Because to each person, it's a different thing. So what is self-care to you?
Yeah. To me, self-care is about those kindnesses, but for me specifically, it was a lot about being grounded, and that is a regular meditation practice. So when I have that regular meditation practice, and I'm more grounded, and I know more of what I need, so then I can ask for what I need from that grounded place. And I think oftentimes then the other can hear what I have to say. And so it helps in setting boundaries and holding boundaries. So I think that's a big part for me, is some kind of way to be quiet with myself every day.
Yeah. And you just mentioned to me, mentioned something that I think is very important. It's the boundaries. Because very often we don't set boundaries. And apart from that, we cross boundaries. We tend to guilt our colleagues into doing things, which I think is really very detrimental to all of us. I know if you are the manager, if you're the supervisor and you're short of staff, then you really need someone to come in. But when someone says no, I think we have to learn to respect that no, and not say to someone, well, I really need you while you're leaving your colleagues short. Well, stop it. Stop it. It's not helpful to any of us.
No, absolutely.
So, but anyway, I think we will get there. Because I think that nurses are seeking more and more education. And as they seek more education, not just, and I'm realizing it's not just that they are trying to get more nursing degrees. That is true. But also they're looking outward towards other things that may be tangential to nursing or a lateral kind of thing. And in those areas, I think that we're going to be a little more self-assured and a little more likely to advocate for ourselves. So I think maybe we'll get there.
Yeah, I hope
Maybe we'll
so,
get there.
because it is finding that balance between, because nursing is about caring, being that caregiver for others. And I think we give a lot of words to, but you have to take care of yourself first. You have to put your mask on first. But nurse leaders and co-workers often don't actually act on that, which is what you
Yeah.
just said. And
Yeah.
how can we do that and make that the norm? Because often when somebody does step up to that, they are felt
Yeah.
guilty or not a
Yeah.
team player. So often as
Yes.
nurses, right, we're on this unit together and we're
Yeah.
this wonderful kind of dysfunctional family.
Yes.
When it comes down to it, we have each other's back, and we're and we will step up, and we're really supportive.
Mm-hmm. Mm-hmm.
But oftentimes that gets lost in the day to day, and how
Yeah.
to step out of
Yeah.
that and be a
Yeah.
role model. Yeah.
Yeah. Yeah. Yeah. Yeah. And for each of us, we actually have to find our own way of stepping out of that. Of even just something like leaving work at work, because sometimes that's really hard.
Yeah. Mhm.
Sometimes that's really hard. Um, I remember realizing that, my whole day cycle, even when I was not at work, was somehow revolving around work. Other things were being planned in relation to work. And, there was a time I had to stop. Stop. No, 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 that's not how it works. Work needs to be planned in relation to life, not life in relation to work. Um,
Right.
yeah. So, what would you say is your greatest achievement so far?
Well, talking about that work-life balance, I think it's my family.
Your family.
And
Okay.
having but in relationship to work, having that healthy family, because it took a lot to get there. Unhealthy boundaries don't stop at work, right? If you have these
Exactly.
unhealthy boundaries at work, it happens at home, it affects your relationships at home.
Hmm.
So that self-growth, enough growth to have a healthy relationship, to have those healthy boundaries, to have a healthy work life.
Yeah, yeah, yeah. And it's a little difficult. It's a little difficult to get there. Because when you start, you can be so excited about all of this and all of this great stuff that you see around you. It can be scary, it can be exciting, and you get lost in it. Before you know it, you're really overwhelmed by it, and
Mhm.
and you haven't given yourself the permission even to step away and to set boundaries and to be you, and
Right,
instead of being a nurse, to be you.
right.
you know
And oftentimes people come into nursing, and I think you've said this before for sure on your program, to come into nursing because something has happened, so they want to care for others. So we're often coming in from this place where there's been trauma.
Yes.
And so we act from that trauma. And sometimes the way we act is to do everything and be
Yes.
everything for
Mm-hmm.
everybody. And
Mm-hmm.
isn't that great for a manager? So they're not going to
Mm-hmm.
stop us from having that
Exactly.
response.
Exactly.
And so
Exactly.
that is, it comes and we get these praise that we need. Because of the place
Yeah.
we're coming from, and nobody's going to stop it until, like you said, it just gets out of control and we're burnt
Yeah.
out.
Yeah. 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 And so I'm going to move into this. You have this, we talked about your achievement, but you have this thing called Crush the Pain.
Yeah.
Where did that come from? What made you create this?
So I'd been working in many different areas of nursing, and when I had worked in hospice, and I work with people at the end of life that had a lot of pain, emotional and physical pain, and it would be interesting to see that oftentimes they would fight against having any kind of pain management because of thoughts and beliefs around that. And then I worked in an area of with people with substance use issues. And I would see that a lot of the substance use came from wanting to numb pain, physical and emotional pain. And it was just so interesting exploring both sides of that pain, and really is really interested in the emotional component that comes with chronic physical pain. And being a nurse, I would see all these silos of care, as we say, addressing pain, maybe with a psychologist, maybe with medications, maybe with physical therapy, but there wasn't anybody bringing it back to treat the person as a whole. And so I saw that need. So I created Crush the Pain to hopefully share resources and education about how to manage chronic pain, along with the emotional component of it, and where they could get other resources, like seek support from other places.
Yeah. You mentioned a couple of times about the emotional component of physical pain. But do you think that we actually recognize the reverse, the physical component of emotional pain?
No, I don't think we recognize either, mostly. And that's right. That's what I'm trying to spread that word, that it's so complex and so interrelated. And as much as we talk about the mind-body connection and the body-mind connection, I don't know how much we, as a whole society, how much we really believe it.
Yes.
And I don't know that we do recognize it.
Yeah.
And it's both, like you said, it's definitely both.
Absolutely, it is both. Absolutely both. And I was interested because I looked at this Crush the Pain, and I thought, well, what does this crush stand for? And it's an anagram.
Yes. Yeah.
So tell me about that.
Well, I have a background. I teach mindful meditation. I've been doing that for quite a few years. So I was trying to figure out how we could put, what are all the important ingredients in dealing with this kind of chronic pain. So I came up with Crush. I kind of liked it. So C stands for compassion. So it's really important with dealing with chronic pain, physical, emotional pain, from a place of compassion. So I think that's the grounding place. The R is for relate. So how we relate to that. And that is a big part of this mindfulness practice. It's this part of acceptance, not meaning we're going to settle for where we're at, but can we accept where we're at now, release the energy around trying to be different in this moment. So we have the energy to move forward. So a lot of that, how we're relating to it, the story we're telling ourselves about this pain. What does it mean about us? What does it mean about others? What does it mean about our life? Can we relate in a healthy way? Understanding it is definitely working with a provider. It's a complex thing, working with a provider that works with you, because you're collaborating in this adventure, this exploration, and then giving other resources what actually is chronic pain and trying to explain this complex thing. Seeking support in so many ways. And, I talk about some of the basics of sleep and nutrition and exercise and mindful meditation, but I've also listed many other places. Is it a support group that's most beneficial? Is it yoga? Is it breath work? Is it, I worked with this wonderful woman that does acrobatics, circus sanctuary, and is it fun? Will acupuncture be beneficial? Will chiropractic be beneficial? And just trying to give examples of what may work for you and how to explore that, because it's going to be different for all of us. And the H is for healing. So what
Yeah.
brings us to healing will be so individualized.
Yeah, yeah. I looked at that and I thought, wow, this is awesome.
Oh, thank you.
Really, I loved it. I loved it. So, what advice you think you'd give to somebody who wants to be a nurse? What would you say?
I would say some of the stuff that we just talked about, own it.
Own
Be-
it.
oh, no, really know what a nurse is. Again, revisiting Florence Nightingale, like, oh my gosh, we are in such a perfect spot as a nurse to be that person that brings everything together to help the person heal holistically, bring
Yeah.
all those things together, help heal the person internally, their internal environment, their external environment. I love what you said. I'm not going to steal it, but I'm going to repeat it. Helping the person in this time of need maintain their dignity. And I'll
Yes.
say compassion, being a
Yeah.
compassionate presence in this big business of medicine and hospitals. Know that what
Yeah.
we are as nurses, being that compassionate presence that holds and maintains dignity for the person at the point
Yes.
they're healing, that is important, that it's not a small thing, it's not a weak thing, it's not a simple thing, and it could be the most important part for the person's healing journey. And own that and stand up for it and create boundaries around letting us be that person and do that.
Yeah. 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 Yes. And your word for the nursing is compassionate.
Compassion is my word. Yeah.
Yeah. Yeah. Yeah. Compassion. And I'm glad that you said that. And quite a few nurses say that. Um, and I say, okay, so you've recognized that we need to be compassionate. That compassion needs to be extended to us, though.
Yeah. Yeah. Who is it that says, you might know, but compassion without compassion for self is not complete?
It's not. Yeah, I'm not sure who said it, but I know. Yes,
Yeah.
exactly, exactly, exactly. So
And
we,
I'm sorry, but this is an area that I really love, and I'm passionate about this compassion piece, because I think a lot of times people think compassion is weak, and it's absolutely not. So there's so much strength in compassion. And Brene Brown said, when she studied people that are most compassionate that in the world, like Mother Teresa, they are the most boundaried, which is an interesting way to say it, but they have really strong boundaries. And so as you're working in the hospital as a nurse, it may not be giving everybody everything they need. It may be creating those boundaries and taking care of ourselves. It may be saying no. So really knowing that true compassion is really grounded and really strong and really
yeah,
vital.
yeah, 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 yeah. It is, and sometimes recognizing that it is not always easy to be compassionate. It is
No,
not always easy.
no.
When you meet people who are sometimes having the very worst day of their life, they sometimes people can be very what comes out of them on this worst day they had the worst news cannot it's not always pretty.
No.
And it can be hard to feel compassion for someone who's giving off stuff like that. And sometimes you really have to kind of like rise above that and find a way to be compassionate and understand that if that were you, you'd probably be worse, you know?
Yeah.
So,
And exactly, and understanding from a compassionate place that is probably there, it's a bad day, it's probably a trauma response. And if we understood the context of that person's reactions and not take it personally, right, that
right.
part of not taking it personally, not taking abuse, right,
Mhm.
but
Yeah, that's a
definitely
different
having
thing.
those strong boundaries, but then being able to be present for that person as they're
Yeah.
in pain and expressing it in whatever
Mm-hmm.
way they do, with tears or
Yeah.
with anger or with
Yeah.
shouting, and
Yeah.
not needing to take that on.
Yeah. Yeah. That's a huge thing. That's a huge thing. Um, and that's a growth curve. That's
Yes.
that's a really
Yes.
that's a really hard growth thing sometimes, but it can be done.
Yeah, and that's where that self-care of really taking care of yourself and healing your
Yeah.
wounds comes in, or it
Yeah.
will present as burnout
Mm-hmm.
for
Mm-hmm.
sure.
Mm-hmm. Mm-hmm. Yes, indeed. Yes, indeed. Yes, indeed. And giving our own emotions space to be, allow ourselves um the space just to feel our own emotions, because as we go through our day, very often we do not have time to actually allow ourselves the grace to feel the emotion that we feel, and sometimes it can come crashing in on you and when you least expect it.
Yes.
Yeah.
Yeah.
Yes, it can. Yeah, yes, it can. So um well, that's one of the growth things that if I, had to give advice to somebody about becoming a nurse, I think that's one of the places that I would start. You really have to take care, not just of your physical self. Your physical self, is easier actually to take care of than your emotional self,
Yeah.
because we tend to hide, even from ourselves, we tend to hide our emotions.
Yeah.
You can do it if you can.
Yeah. And sadly, um, because we always want to take care of everybody else, but sadly, if we can help nurses understand that taking care of yourself will actually benefit your patients, maybe we'll start taking care of taking better care of ourselves. And then yeah.
Yes, indeed. Yes, indeed. It will actually benefit someone else. Yes. Oh dear. And thank you so very much for this conversation. It has been enlightening. I love your crush thing, I have to tell you. I listened to that. I thought, oh my, this is really because it's such a comprehensive way to approach pain, and to approach, what pain actually is. Because
Yeah.
sometimes we don't even recognize pain as pain, so what pain actually is, and to approach it, the way to approach dealing with it, and living with it or healing from it. It's, for me, that was huge when I saw it. Thank you so much for that.
Well, thank you. I really appreciate that. And yeah, I appreciate that. And any feedbacks or comment or anything else that I just want to share what I can so that people can heal, because it is so complex and can be
Yeah.
so isolating. So thank you.
Yeah, and I will put the link to your website in the description box.
Great. Thank you.
All
It
right.
was really nice talking to you and nice meeting you.
And you too, Anne. It's been a pleasure. Thank you. Have a great one.
You too. Bye-bye.
Bye bye.